We are back here on Carolina Women. We're here at Bluffton Aesthetics, and I'm super excited to be here with Sheree. I mean, this is like my ideal chair. It's the perfect place to be. We're talking about something a little bit different and interesting today. We're talking about adult acne, all different kinds of acne. And you just said that laser hair removal is a great sort of introduction into acne.
It is. A lot of people get what we call folliculitis. So they're ingrown follicles, they're bumps that look like acne. One of the cures for folliculitis is permanent laser hair removal.
Okay.
And so it reduces the follicle activity, and therefore it reduces the bumps and creates less oil production.
How often do you have to have a treatment like that? Is it literally a one and done, or every 6 months?
It is not a one and done. So what we do is we treat each hair cycle. So depending on your ethnicity and your background, you have multiple hair cycles. And it can be anywhere from, with our device, it's a newer technology, so our device is pain-free.
Oh, wow.
And so yes, this is new technology. The older lasers, which still work great, are not pain-free. And they also require anywhere from 12 to 15 treatments for what we call a no-shave.
Got it.
This new device that we have called the Modus AX, it actually gets hair dependent on the density of it. You know, some ethnic groups have a lot more hair density. It can get anywhere from 6 to 9 to 10 treatments for a no shave. So it's definitely cut it down quite a bit.
Oh, wow. Yeah. How does that relate then to acne? People just mistake acne for that, or vice versa?
Yeah, some people do mistake folliculitis for acne.
Okay.
And it, you know, it's looks very similar.
Can you explain to me, when we hear acne or say acne, I think it means a lot of things to a lot of different people. I was even saying here at 68, I've got these little white bumps. Is that acne? And they're like, no, we got that's something completely different.
Completely different. It's Melia's.
Got it. I'm very interested in those. Talk to us about the adult acne and acne in general.
Well, acne in general, it isn't a one-size-fits-all. You know, here at Bluffton Aesthetics and what I do, I worked in derm for 8 years, so I saw a lot of acne.
Got it.
Over the years, and kind of got my little niche on how I do things. And as some people say, there's more than one way to skin a cat. But there is different types of acne. You have adult acne, you have teenage acne. Some are hormone related, some are allergy related. Some are, you know, come from birth control, some don't. More so than not, adult acne usually comes from high progesterone levels, creates that cystic acne.
So let me ask you a question about that. If I'm interested, let's say I have acne and I really want to get on a regimen, come in and talk to you, have a consultation, and you can guide me with a treatment plan that will work. Is that what you like to do?
That's correct. Yes, correct. Because there is different kinds of acne, so it isn't a one plan for each individual. So I kind of go over your habits and the different ways in which your skincare routine is, because that's very important.
Okay.
Because if someone's not going to stick to something or do it, then
we got to come up with plan B.
You got to come up with a plan B. So, getting to know my patients and getting to know what their lifestyles are and their sports and hobbies and that really helps me kind of narrow down how to create a treatment for them.
What's really interesting is you're really talking about building a relationship with people.
Well,
so,
yeah.
I mean, but that makes sense, so that your patients that come end up being part of your family, because you sort of end up knowing their whole routine.
Yes.
What about different ages? Do you recommend different kinds of treatments, facials, things like that, for different ages too?
I do. Adult acne is a lot different than teenage acne for sure. Teenage acne is 100% hormones. So a lot of times it's a matter of keeping it under control to get them through the years. May not be able to clear them up completely, have that realistic understanding, and then get them through those teen years, and then just teach proper skincare. A lot of times acne comes from improper skincare as well. We've had a big increase of the mask knee.
Yes.
From wearing the mask, not washing them, not changing them, and the bacterial that stays on the skin. So there's many, many different reasons why people are breaking out.
How often do you, I was just saying, facials are something that I really want to begin to put into my regimen. How often do you recommend people begin to do a facial?
You can begin anytime.
Yeah, well,
now would be a good time to start. Monthly is good to stick with your skin cycles, and just to have that, you learn something each time you come in, at least with me. my goal is to educate my patients on how to take care of their skin. There's a lot of myths out there to debunk, and a lot of stuff on the internet that's misinformation or misleading, and
shocking.
Yeah.
Well, Sheree, I think this is really informative, and we have to keep having you back. We decided, we talked before, we're all going to come in and do a facial together. It sounds wonderful. You're great to talk to.
Thank you.
Stay with us. There's more to come here on Carolina Women.